Welcome back to another round of Misinformation Monday, because misinformation is literally killing us. My name's Mel. I'm a fourth-year medical student. I'm applying into OBGYN, and today we're going to talk about Tylenol and autism. Because when we talk about misinformation, we're talking about the proliferation of ideas that are misleading, that leave out a good chunk of information, or that misinterpret the studies. To start off, let's read from ACOG, the American College of Obstetricians and Gynecologists, who said that pregnant patients should not be frightened away from the many benefits of acetaminophen, which is safe and one of the few options pregnant people have for pain relief. Let's first talk about the study that RFK Jr. is using to base his entire claim on. That conveniently was published August 14th, after RFK Jr. said that he would find the cause of autism by September. When you're analyzing misinformation, it's important to see the method section, or how the study was carried out. This is a systematic review, meaning it is not a primary study. They did not conduct any randomized controlled trials. They did not gather any of their own data. They just looked at the studies that are currently published and tried to use them to come to a conclusion. They found 46 studies that they included in this analysis. Of those, only 27 reported positive associations between acetaminophen use and neurodevelopmental disorders. 9 showed no significant link, and 4 indicated negative associations. Looking into it even further, only 20 of those studies were on ADHD, and only 8 of those studies were on autism. So not even all of those studies that they looked at were about acetaminophen use and autism. Only 8 of them were. Most of the reviewed studies had a large sample size, so that's another thing you want to look at. Some of them had over 500 participants. And when they came to a conclusion, they said that their analysis demonstrated evidence consistent with an association between exposure to acetaminophen and neurodevelopmental disorders, autism, and ADHD. Now, they were very careful to use the word association, because that is the only thing that can be concluded from a systematic review like this. But when we're talking about misinformation, that means that they are leaving out a good chunk of data, and they are not giving you the entire picture. This is one of the largest studies on the topic to date that was published in April 2024. And the goal of this study was to look further into that association between acetaminophen and neurodevelopmental disorders. It was a nationwide cohort study with about 2.5 million participants, making it one of the most reliable studies we have to date. And what they found was that acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability in sibling control analysis. That means for each participant of the study that did have acetaminophen exposure in utero, they matched it to a sibling who did not have acetaminophen exposure in utero. So remember that when we have a study that finds an association between two things, there are other things that can be the cause. These are called confounding variables. So in this instant, there can be confounding variables introduced based on the reason that acetaminophen was taken. For example, infection, fever, migraine, or pain from autoimmune disease would cause someone to take acetaminophen, but would also increase the risk of these different neurodevelopmental disorders. Confounding by parental health and genetics is likely as well, which is what this study found when they controlled it with sibling pairs, because neurodevelopmental disorders are highly heritable, meaning they are passed down through genetics. I hope this was a little bit helpful and informative, so meet me back here next week for another Misinformation Monday.